Hi, my name is Cindy. For those of you who don't know me, I am an acupuncture therapist, a Pilates instructor, and a holistic nutritionist. Today I wanted to focus on the low back and just give you a couple of simple ideas and thoughts about how to help you with low back discomfort and low back pain. So there's a number of reasons why we might actually be feeling pain or discomfort in the low back. So there may be structural reasons. The bones might be misaligned and it might be pinching on a nerve. The muscles might get tight because of that misalignment of the bones. There might be weakness of the bones. Structurally, you might have osteoporosis or stenosis that is weakening and narrowing the bones themselves. There may be compression, so there may be the bones are compressed together, and that compression on the discs are pinching at the nerve as well. So that's structural. There may be some muscular reasons why you feel back pain or discomfort. Oftentimes this is more of the case than some of the other ones for the majority of us that just have some low back discomfort. There's tightness because of weakness. Weakness could be sitting at a desk for a long period of time and not getting up to move. There may be weakness because of age. We're not exercising as much, getting out and moving, so there's a little bit of atrophy that happens as well. There may be an imbalance in the muscular structure. We might have one side that's tighter and one side that's looser, or one side that's stronger, one side that's weaker. And that creates an imbalance as well. So when we walk, that imbalance might catch a nerve, or it might impede us in how we properly move the structure through space, and that can lead to more tightness and pain and discomfort. So before you try to do any exercises or ideas that I might recommend, make sure that you check in with your therapist, whether it's an acupuncture therapist like me, or a physiotherapist, a chiropractor, your doctor. Just make sure that any exercises that you start are appropriate for you to do, okay? So we talked about back pain or discomfort happening because of structure, because of muscular. You might have had an injury, and that injury could actually be like a surgical injury. Like there's trauma that happens when the body is cut open, right? So there may be a surgical reason why you got a little bit of back pain happening there, maybe some scar tissue around that area. And you might have fallen, or you might have been hit. You might have gotten into a car accident. So there's been trauma to the tissues themselves. In Chinese medicine, we think of back pain or discomfort in a variety of ways, but generally low back pain kind of targets in around the kidney qi. So when there's weakness, we say that there's kidney qi deficiency, and oftentimes that can lead to a kind of a dull sort of discomfort in the back. Now, often when we're under stress, that's one of the big ones that will stop the flow of energy, the flow of qi moving in around that area. And oftentimes when we're stressed, everything just tightens up, and that tightness, that liver energy tightness, can lead to pain and discomfort as well. That's often usually pretty strong. It comes and goes. It might be throbby in nature, and then the final one would be what we call a stasis type situation, where the blood flow really isn't moving, and that's usually a trauma-based effect. So that's usually like, we've fallen. Again, the stasis can happen after surgery, right after surgery, because that area has had trauma to it and the blood flow is not easily moving. So those are three things that we would look at in an acupuncture treatment to help facilitate the movement of qi, the movement of blood, the flow through the tissues, the energy into the muscles. And we would use cupping, moxa, needles. These are all excellent modalities for treating back pain and discomfort. But here are a couple of very simple ideas of things you can do at home to help minimize the amount of discomfort that you might feel and maximize the amount of enjoyment in your life you can have.